Well, now to how it's one less potentially life-saving option. Tonight, Oregon lawmakers and mental health leaders are pushing back in light of the federal government's shutdown of a crisis line for LGBTQ+ youth.
Joelle Jones is going beyond the headlines with reaction and the effort to reverse this move.
As Portland heads into Pride this weekend, members of the LGBTQ+ community who are under the age of 25 can no longer be connected to culturally specific counselors when dialing 988. I tried calling the crisis hotline myself today, and option 3 doesn't exist.
You've reached the 988 Suicide and Crisis Lifeline.
Mental health advocates ringing the alarm as the Substance Abuse and Mental Health Services Administration announced Thursday it would no longer silo LGBTQ+ youth services in an effort to focus on all help seekers.
It's very arbitrary, it's very cruel, and it will ultimately probably cost lives.
According to 988, since launching the subnetwork supporting LGBTQ+ youth in 2022, the Lifeline has received more than 1.5 million calls, making 600,000 crisis interventions last year alone. Chris Bonaff, executive director of NAMI Oregon, which helped launch 988 3 years ago, says he's now concerned less LGBTQ+ youth will seek help.
Those populations have special needs. It's hard for them to reach out because they're so vulnerable. They really need that tailored resource.
It makes a difference for them who are doing the job of answering the lines, and makes a difference for the other person who is seeking help. It is a lifesaver.
U.S. Representative Andrea Salinas co-signing a letter with 100 Democrats urging House Appropriations Committee leaders to restore funding the LGBTQ+ Youth Lifeline in next year's federal budget. It notes suicide is the second leading cause of deaths in youth, with LGBTQ+ teens 4 times more likely to attempt than their peers.
My first response was devastation, and then my second response was anger and advocacy. And what can we do about this?
In a phone interview today, Congresswoman Salinas criticizing the Trump administration's recent Medicaid cuts, telling me 1 in every $4 helps fund mental health.
So he is gutting Medicaid, which means he's gutting mental health. He's gutting SAMHSA, which means services that go towards a 988 helpline.
Now, I did reach out to the White House for a response to Salinas' comments, though they simply redirected me to the SAMHSA statement that we covered earlier in this report. Moving forward, NAMI Oregon and state officials say they're working to ensure operators will respond with compassion to all callers. Reporting in Portland tonight, I'm Joelle Jones, Quinn 6 News.